welcome to Pet Talk with Dr. Lee. I'm John Mondelli, your host, and here to bring you a new show. Doc, we haven't had you in a while because, let me tell you, it was a really busy summer. The first
Spector.
male to ever win Dancing with the Gloucester County Stars. This is it, the trophy. This is it.
Yes.
Pretty good that it stayed in the Spector household 2 straight years because your wife Bernadette won 2 years ago, and you
Yes.
won this year. And better yet, I know it's great that you won it all, but you helped us raise over $19,000. And I think last count, because we were still getting money in, as of a couple weeks ago, we went over $19,500.
Very good.
So to you, thank you very much. We appreciate everything you've done for our channel to give us some exposure, and we'll make sure we remember this, and we appreciate it. And what about the experience? Let's talk about that before
Yes.
we get into the real reason we're here.
It was a great pleasure. I really enjoyed it. The dancing itself is lots of fun. The fundraising proved to be a lot of fun. There was pressure in it, but there was great people involved, great people in the fundraising. I had a staff. You can't even appreciate how good your staff is until you throw them some real challenges, and boy, did they come through for
Yeah,
it.
and I said that night, the one chance I had a chance to speak, how great the people over at Gray Fox Animal Hospital are, your entire staff. You, as your wife, by the way, I talked to your wife yesterday, and she now told me she's the, when anybody wants to talk about designer bag bingo, they go to her, and she
Yes.
gets them started, because that was another great event we had. And this gives us a great chance also to thank the people that helped us out. People at Glassboro VFW, thank you very much. Who am I for? Bogies. People over at Bogies, super job. Al Bartolomeo, and as obviously you and your staff, thank you very much to everybody.
Other organizations too. There was Tuxedo Gallery. They gave me a tuxedo to wear at a race to promote the Dancing with the Stars. I was running, sweating in this tuxedo. They didn't even charge me for it.
As a matter of fact, Carter, our cameraman, he's wearing that at his prom, that tux.
Yeah, I'm sure.
No, I'm just joking.
And then Giannina's that discounted the pizza for us that we sold at the designer bag bingo.
Oh, okay. Yeah.
There's just a lot of different organizations
right.
that came through for us.
So thank you. I know if we sat there, because I just went through the list.
Right.
There was probably easily over 100 names of people that somehow donated, bought tickets, things like that. So thank you to everybody there.
And then there's my wife, who managed me, which was
that's
managed
the hard
us
part.
all, I think.
Yeah, no, she managed me. I found out. I almost thought I was married to her there for a while, the way she bosses me around.
She got a lot
you
done.
like that, Zach? Zach, our other cameraman, grew to appreciate Bernadette a lot. Okay, let's talk about why we're here. First of all, in honor of you, a graduate of Michigan.
Yes.
Right, the Wolverines. Yes. I wore my Michigan colors today.
Thank you so much.
I've got to be honest with you, it was total fluke. What are the odds, though, of me wearing the Michigan colors?
Yes.
You're in your Michigan scrubs.
Yes.
You went to Michigan. My daughter's Ohio State, so we're big rivals.
Realize. We do
even
have
though I'm a
rivalries.
big Notre Dame
Not
guy.
enemies, rivals.
Right. We got the Ohio State, the red behind us. It might,
right.
Well, it's almost red. Anyway, you brought some results of some surgeries in today.
Yes, I did.
And boy, I'm going to be hitting the Purell right after this show. So why don't we? Bladder stones, I guess. These are all bladder stones of some sort?
These are all bladder stones. These were stones that developed within the urinary bladder of various dogs and obviously caused problems there. These dogs came in primarily because the owners were concerned that they were urinating all over the house. They're having accidents.
Right. Now,
and they were
what are
asking
we looking at right here? Like, what is this from?
That is actually from the bladder.
From what, like a specific dog or?
Oh, that was a Cocker Spaniel.
Okay.
And she came in. She was really in pain, this one. What's more, that stone managed to lodge towards the bottom of the bladder where the urethra comes out, so the outflow was a little bit obstructed. She was having real trouble urinating. She was in great pain.
Now, the sizes are different.
Yes.
We're never going to be able to get a shot of this, but this one's very small. I don't know how close we can get that. Hopefully my hands are clean. I mean, I don't want to look dirty on TV, Doc. Come on. But okay, what do we got here?
All right. That's a cystine stone. And that particular stone, as much as the other ones seem bad, some of these are really big, that one was really a problem because it went down the bladder into the urethra and absolutely obstructed the outflow tract. So that dog would have been dead within 48 hours if we hadn't gotten to do surgery.
Now, how would a pet owner know that there's a problem? Just by what you said?
The dog couldn't
urinating all the
urinate.
time?
The dog was was constantly asking to go out, constant.
And-
Every
but
5 minutes trying
could
to
they
urinate.
go?
No.
But they
And
couldn't
nothing
go.
was coming out.
Okay, now we have all different sizes. These are just like, it's weird because they're stones.
They're stones, they're
almost like
smooth. These are
pebbles.
kind of pretty ones. These are called triple phosphate stones. These are real classic ones. And they vary in size from very small to quite
Right.
large. And once again, we get into this problem with the size. If it's really big, it'll press on a bladder, be really uncomfortable. If it's really tiny, it will just pass through. But if it's just the right size, it can pass out of the bladder into the urethra and get stuck. And those are the ones that give us the biggest headaches.
No, I mean, when you see the different kinds, does it depend? I mean, these could come from any dog? I mean, when you
well-
see this, or a stone like this just comes from a specific dog?
Okay. That stone I mentioned was a triple phosphate stone.
Right.
And that particular stone is the result of a bacterial infection in the bladder. When that happens, the bacteria grow in the bladder and they break down urea, which is always present in urine, and that produces ammonia. The ammonia makes the urine very basic, the opposite of acid. And when that happens, calcium, phosphorus, and magnesium come out of solution. They form little crystals and they coalesce to form these stones.
Right.
So this is due to infection. That dog was probably, if I remember, a miniature Schnauzer. Schnauzers get a lot of bladder infections and they got a lot of bladder stones. There's certain breeds where it's more common.
And what
That's
about
one of
this?
them.
Almost looks like a bar of soap.
That was a beautiful stone. It was another Cocker Spaniel. Beautiful stone, just that it's pretty. Not nice in the dog, though. The thing that I liked about that one is very smooth. So the dog actually barely knew it was there.
I was thinking
Although
about
it was
pavers
quite
for my
heavy.
pool, but you know, this might be nice.
Yeah.
I need a lot, but yeah, that's really strange.
So that one, because it's not jagged, was less irritating to
Right.
the dog. The other problem with these stones, as I mentioned, that stone came from infection as well. If they come from infection, very often the dog will come in because it's having a problem urinating, because the bladder's infected and it hurts.
Now, what causes the infection? Could it be? Is there any reason?
The bacteria, it's bacteria, and the bacteria are usually bacteria that come somewhere from the body. In other words, it could be staph, which is normal on the skin, or E. coli, which is normal in the bowel. The problem is neither one belongs in the bladder, and sometimes they manage to make the trip, swim against the current, go up into the bladder and cause infection. That happens more in females than males.
Right.
And so we get a lot of female dogs with bladder infections, and if it's not treated fairly quickly, either because the person's too busy to attend to it or because the dog's showing no clinical signs and a person didn't know, they may get these stones. The problem is at that point, if we give antibiotics and don't know they have stones, the dog will get better, but then a month later they'll be back with an infection because the bacteria hide in the stone and they come back out once the bladder infection is cleared. So it causes recurrent bladder infections. We find them with x-rays.
Is it always surgery, or is there a way to get them out, laser or anything like that?
In humans, they've got various ways of
Right.
using ultrasound to break them up. We don't do that. I don't know anybody doing that with animals.
Right.
We do sometimes use diet to dissolve the stones, and that gives you a slower way of getting them out. If they're obstructing the dog, if they're actually blocking the urethra, so you have only a day or two, then you need to do surgery.
Okay.
Otherwise, you have several options. Usually, I find surgery is a very effective way of doing it.
And that's something, they bring the dog in, you get them right into the operating room and go right at it, right?
Usually,
Or
it
do you-
depends. If the dog's blocked, you need to do it that day.
Right.
If the dog's not blocked, you could take it in a couple days.
And now, do you do x-rays at your place, or is that?
We do the x-rays.
do the
Most
X-ray and-
animal hospitals do have
Okay.
radiograph machines.
Okay. Let's switch topics now and talk about behavior. We're going to have a dog on in the next segment who looks well behaved. We met before the show started. Some people have misbehaving dogs, some don't. Is that because they're not trained right, or
Is it just that?
is it just a breed of dog? What is it?
It could be either. In fact, whether you're talking about dog behavior or any other behavior of almost any other animal, it's about a 50-50 between environmental factors, meaning what's learned, and what's inherited in the dog, basically the genetic makeup. So we have certain breeds that have been made to be specifically tough. In other words, they're supposed to be guard dogs. They're supposed to have a certain level of assertiveness, maybe even aggression, in order to do their job, which is protect their family or protect their home.
And then would that be like a German Shepherd, a pit bull?
Yeah, German Shepherd, not so much a pit bull, which was more made to fight dogs than.
Okay.
But I would say more like a German Shepherd or a Rottweiler or a Chow. These are dogs which were genetically made to be a serious dog. Now, the good news is, especially in the case of German Shepherds, we've got some very big brains there. So they're very, very trainable. So although they're trained to be assertive, to watch and judge, they're capable of being trained to make sure that they respond to their owners so that they will behave well. But they do require training. If you get a dog that's potentially aggressive, the most important thing you can do is train the dog so that it can become responsive to your will and basically do your bidding.
I want to get back to something you said because I was a little shocked. When I talked about pit bulls, so you don't suggest somebody get a pit bull as a pet?
No, I was saying pit bulls are not particularly, we're not particularly made to be aggressive towards people. They were really bred out of bulldogs, really. And it was a combination of a bulldog with a terrier. They wanted to get some dog that would aggressively fight with other animals, particularly other dogs.
Right.
That was the original intent.
But you can get a pit bull who you can train and...
Oh, you can get a pit bull that doesn't even want to fight anything, ever,
Right.
under any circumstances.
So it's just a misconception
Their aggression
when you hear
to
a pit
people,
bull, you know, people
yeah,
think automatically.
Yes, they almost have to be trained specifically to be nasty to people in order to be aggressive with people. Most of the pit bulls are not very aggressive with people. The few that are very tough, powerful jaws, impervious to pain, and are really pretty dangerous. But the vast majority of pit bulls that I've seen have really been a decent breed with people, and most of them have been even good with dogs.
Okay. We're going to take a break. When we come back, Christine Deek, who's the Director of Guidance here at GCIT, is going to come in with her dog. I'm going to think of Monty. I'm thinking, let's make a deal. That's how I remember that.
Right.
Is that Monty Hall? Anyway, we're going to, and it just happens to be blind. So an interesting topic there. And then we'll have a question from one of our viewers and talk about that later on. So we're going to take a break. We'll come back after this timeout. And welcome back to Pet Talk with Dr. Lee. And Dr. Lee, and we have a special guest. Our Director of Guidance at GCIT, Christine Deek, is joining us. Christine, welcome to the show. I know you're excited to be on.
I am.
You couldn't wait. I didn't want to panic you too much, so I laid it on you last second. And you have Monty with you.
I do.
Why don't you tell us a little bit about Monty, because he's not a typical dog, I mean, as far as health is.
Monty's an 8-year-old Springer Spaniel who about 2 years ago suffers from a disease called SARS, which rendered him blind. He literally pretty much went blind overnight. So.
Now, is that something you see often, Dr. Lee?
No, it isn't very common at all, though we do see it some.
And I guess it's something that's not ever going to heal itself, can't be cured, or?
No, it can be treated initially. You try to treat it. I know in this case you tried steroids for a while. Mm-hmm. In this case it didn't help, and in many cases it doesn't.
Now, looking at the dog, aside from being blind, I mean, does it look like a healthy dog? The disposition seems like the dog's been pretty good since it's been on the set.
In a few minutes that I've seen him, he looks like a wonderful dog. He's got a great disposition and he seems happy. But I understand that he has some other physical issues as well.
He does have some other issues as well. Since he was a puppy, he did suffer from seizures, so he is considered an epileptic. He also has an underactive thyroid, which sometimes makes his fur grow kind of irregular. He's got that spotty look to him. And he also has some immune disorders, which he gets some skin infections frequently, so he's on antibiotics quite a bit for that. So he's a handful, but all in all, he really is a happy dog.
I know a couple of weeks ago you had him out for a walkathon, so obviously the dog's active, it gets there, and obviously you walk him, which I guess is all good things.
It's definitely good. You want the dog to have as complete a life as possible, obviously, and you've done looks like you've done a phenomenal job taking care of. Well, it's a lot of work, but he probably pays you back, I would think.
Yes. One of the things he does, he actually loves the beach. He loves swimming in the ocean, so we try and exercise him as much as we can. I keep him on a leash because he can't see, so I don't know where he'll go, but he loves the beach.
I want to bring up something interesting because your house was just finished being rebuilt, right? A new house in Cherry Hill, or rebuilt your house. So what kind of obstacles for a dog who's used to living in one place and now everything's different. I mean, is there bumping in walls, or how does the dog get around?
Initially, when we first moved in, we tried to keep him contained to a smaller area in the house until he got used to it. But believe it or not, still, you know, we've been there almost a year now, and he still bumps into things. And we did recently buy him a harness that has a halo on it that kind of comes out in front of his snoot, and it kind of bumps the guard before it bumps his face. So we're trying that out. We just got it.
It's like having a walking cane.
Yeah, it's been a little helpful, but he's not a big fan of it yet. So we're kind of weaning him onto that.
And the no tail, is that common for a breed like that, or is that something that?
I believe they dock it when he's born.
When he was a couple days old. That's
is that something typical for that
spaniel.
kind? Okay. Okay. Any questions for Christine, Doc? Or thoughts? You want to check him out, take a look at the dog?
Sure, I'd love to look
Come
at
here,
him.
Monty.
Mainly, it's nice to pet him. He's a
Right. Pets
good
and kids,
boy.
you're really not supposed to work with on TV because they're hard. But look, we have two trained professionals, not me.
Here you go. Good boy. There you go. That's a good dog. He's very gentle when he takes the treat. That's very sweet of him. And we already talked about it, but I understand he's got clean ears, which is a big deal for a Springer
Yeah,
Spaniel.
he's never had a problem with his ears.
That is fortunate. I guess he has his issues, but he really does respond well to the treatment you're doing for him.
When he gets tired, he gets a little grouchy.
And how the car rides, obviously, from Cherry Hill to down the shore. How's the dog in the car?
Initially, when he was a puppy, he wasn't really a big fan of them, but he's kind of gotten used to it now, and he doesn't really. I don't say he loves it. He's not a dog that hangs his head out the window, but he sleeps.
I know when I used to have a dog, find it hard to believe, but yes, I had a dog.
You had a dog.
I was 10.
All right.
The dog got in the car, knew one of two things: haircut or vet. Wasn't a happy dog in the car.
No.
Wasn't a happy dog in the car. Well, Christine, thank you very much for coming in.
Thank you.
Bringing Monty in. We appreciate it. We're going to take a break, come back, and we'll talk some more. Stay
Sounds
tuned.
good.
We'll be right back. Doc, great segment with Christine Deek and Monty. And now our final segment, and that's where we ask the vet. That you're the vet, by the way. You know that?
Okay, yes, I realize.
I was going to play the vet, but I figured we got a better chance of you answering. And by the way, if you have a question for Dr. Lee, you can email me, which is jmondelli@gcecnj.org. We'll put that up on the screen, jmondelli@gcecnj.org. Just under subject put ask Dr. Lee, something like that. Yeah, we'll figure it out once I open the email. Anyway, here we go. We got one of our viewers. I heard from a collie owner, so I don't know if this guy wants a collie anyway, that you have to be careful with heartworm prevention. If I'm reading this right. Mm-hmm. Is that true?
This is a concern. When the heartworm medication that's used right now is primarily ivermectin or some derivative of it. When ivermectin was originally produced to prevent heartworms, the company that put it out was going to use it at a very high dose, about 100 microgram per kilogram, because they wanted to prevent not just heartworms, but virtually every other kind of parasite a dog could have. The problem was certain collies and collie-type dogs, like border collies, had a defect in their blood-brain barrier, which would allow the ivermectin to get into the brain and cause seizures and even more severe problems. So they found that they could avoid that by reducing the dosage, and as long as they didn't go over 50 microgram per kilogram, they had no problems. They put the medication out at 6 microgram per kilogram, which simply means they're at a tenth the dose that could cause a problem in the few dogs that would have the problem. And in doing that, they got rid of the problem. Mm-hmm. So since then, in my practice, we've been using ivermectin successfully in collies, border collies with no problems, no seizures, no other problems, for 20 years. The problem, and there's another medication that's out, which is called Interceptor, which many of the collie breeders went to because they were still afraid, and I understand that. The problem is that Interceptor's been taken off the market temporarily. The company that makes it is having a problem with the factory. There's no problem with the medication, but they can't get it out because of the factory issues. So the collie breeders are now stuck with what are they going to do to prevent heartworms in their dogs? And the answer is, as long as they use the recommended dose for ivermectin, this is HeartGuard, Iverheart, or any of the other products with the various different names, as long as they use the recommended dosage for the recommended weight, they should have absolutely no problem with their breed.
You know, this is a good question, and which leads us to a whole subject for another show. When you're thinking about getting a dog, maybe find out about the breed that you're interested in, the pros, the cons, what you got to look for, what's the easiest to keep, and the next we're going to be taping at the end of the month. Maybe that could be a topic, because I know with Christmas coming up, everybody thinks it's a great idea. Let's get little Johnny a dog for Christmas.
Right.
By the way, don't. Anyway.
Not this John.
Not this Johnny, right. But there's a lot of questions you got to ask. And I know when I spoke to people at the Gloucester County Animal Shelter, you know, they'll tell you the same thing. You know, just don't let it be an impulse buy. Really
Right.
know things. I mean, know that, you know, being a pet owner is a lot of work.
Right, and the real question there isn't which breed is the best breed to have. The question is, what's the breed that's going to most likely fit in your life, and what's going to suit you at this point in your life the best.
Right.
And different breeds for different people. There's no doubt about that.
Okay. And if people need to contact you, Dr. Lee, Gray Fox Animal Hospital, give us the number.
856-848-7070.
Dr. Lee, thanks again. We'll see you again in a couple weeks. For Dr. Lee Spector and our entire crew, I'm John Mondelli. We'll see you next time on Pet Talk with Dr. Lee.